This video explains the specifics of the surgical procedure required to perform a biceps tenodesis operation. In order to explain the surgical procedure, we're going to use the right shoulder as an example. You can see the ball and socket joint of the right shoulder, which connects the scapula, the shoulder blade, to the upper arm. By looking at the specific structures of the shoulder, we can see the clavicle, the collarbone, in the front. Next to it, an extension of the scapula called the acromion, which comes over the top, and the rest of the scapula in the back. We can see the tendons of the rotator cuff attached around both the front as well as the top with the biceps tendon in between. Pain from the biceps is often associated with rotator cuff pathology, which may be addressed in the same procedure. Let's concentrate on the treatment of the long head of the biceps tendon. Bi means two, referring to the fact that the bicep muscle itself has two tendons. The short head attaches on the coracoid, which you can see is a bony prominence, and it is placed outside of the shoulder joint. The second head, the long head of the biceps, attaches onto the top of the shoulder joint. Consequently, this tendon can be a source of pain or symptoms within the shoulder. We perform a biceps tenodesis in order to eliminate the pain or symptoms. The procedure starts with a small incision in the front of the shoulder that allows placement of a working tunnel, called a cannula, into the shoulder joint. A stitch is passed through this cannula and into the biceps tendon to grab hold of the tendon. After this, we cut the biceps off of the top of the socket and prepare to reattach the biceps at the top of the biceps groove. Following this, we will punch a hole up at the top of the biceps groove and place an anchor into this suture, so that it directs the biceps down into the hole. We will finally fix this with a screw. When you put the tendon down into the hole and secure it with a screw, it stays more secure. So as we advance the implant, the screw goes into the hole, completing the repair of the biceps tendon to the humeral head. Now the biceps is attached at the head, and all of the length of the biceps tendon that was previously inside the shoulder joint has been removed out of the shoulder joint. Because it is being reasserted at the top of the head, the biceps is still anchored and its function is maintained. It simply pulls from a different position. Once we reattach the tendon, it needs to heal in this position. So there will be restrictions on your use of the biceps muscle following tenodesis procedure.